Good afternoon, everyone. So today our group will be presenting the consulting analysis of MapleCare Health Network and how it can respond to Ontario's current healthcare workforce crisis. So we will try to focus on the main leadership challenges and provide practical recommendations to improve workforce stability, employee trust, patient care, and long-term sustainability. Next slide, please. So, our main consulting question is how can MapleCare stabilize its workforce while continuing to provide top of the grade, and safe and sustainable healthcare? So, in order to answer this, we try to apply all the concepts from the 5 chapters, including the POLC framework, employee motivation, leadership approach, value-based leadership, communication, and decision making. Next slide, please. So, MapleCare has been experiencing some serious workforce and financial pressure. Nurse turnover has increased from 8% to 27%, and we also saw that employee engagement decreased from 84% to 59%. This has led to vacancies exceeding 20% in some clinical areas. Overtime costs have increased and surpassed $42 million, and agency staffing expenses has also increased to more than $31 million. Next slide, please. So, our central diagnosis is that MapleCare is facing a gap between their strategies and their ability to implement said strategies. So, Sustainable Care 2030 provides a long-term vision which is very strong. However, burnout, staffing shortages, leadership misalignment, and declining employee trust are also very weakened, and also has been weakening the execution part. So MapleCare must stabilize its workforce before it can actually expect their employees to successfully carry the transformation even further. That's all for my part. Now I'd like to call on Nishan. Thank you.
So now I will discuss strategic assessment of MapleCare. MapleCare still has major strengths including integrated healthcare network, experienced professionals, organization reputation, and digital capabilities. However, these strengths are becoming vulnerable because of employee turnover, burnout, communication problems, and growing service demand. MapleCare has valuable resources, but its ability to maintain and efficiently use them is becoming weaker. Next slide, please. Now, this brings us directly to our leadership challenge, that is burnout. Burnout is no longer only an employee wellness issue. It now affects patient safety, staff retention, service quality, and financial performance. Employees are working longer hours with heavier patient assignments, while managers spend much of their time responding of staff emergencies. Overtime and agency staff provide short-term relief, but they don't solve the underlying workforce problem. Next slide, please. The second problem we must confront is our internal trust and communication systems are breaking down. Trust has declined because leadership messages do not always match employees' daily experiences. When leaders discuss efficiency or resource optimization, employees may interpret this term as budget cuts or increased workloads. Communication also tends to flow downward, while employees do not always see how their feedback influences leadership decisions. Now, Anna will continue. Thank you.
MapleCare senior leadership have different priorities. CEO Jennifer Morrison focuses on transformation. CFO Mark Delaney prioritizes financial sustainability. Angela Russo supports employee well-being and patient safety. And Karen McLeod focuses on workload planning. All these priorities are important, but leadership must combine them into one shared and consistent message. Maple is introducing artificial intelligence, virtual care, predictive staffing, and remote monitoring. These technologies may improve healthcare delivery, but employees are concerned about professional autonomy, legal responsibility, workload, and patient relationships. Technology should support clinical judgment and employees rather than replace them. Using the POLC framework, MapleCare has demonstrated strong planning through Sustainable Care 2030. However, organizing changes have reduced local autonomy. The leading function has not created enough employee trust, and control it has focused heavily on performance measurements. The greatest weakness is leading because employees do not consistently feel heard, supported, or connected to the strategy. MapleCare leaders demonstrate different personality characteristics. Morrison is strategic, Delaney is analytical, Rousseau is empathetic, and McLeod is people-focused. However, employee motivation is declining because of exhaustion, limited recognition, workload pressures, and perception of unfairness, especially when agency workers earn more than permanent staff doing similar work. Thank you. MapleCare uses transformational leadership through its long-term vision and transactional leadership, through performance targets and financial controls. However, the organization needs more servant and adaptive leadership. Leaders must listen to employees, support their well-being, and involve them in solving complex workforce and technology challenges. MapleCare decisions involve ethical trade-offs: patient safety, employee well-being, financial responsibility, service access, and technological innovation. Values-based leadership requires fairness, transparency, compassion, and accountability. Employees need to understand not only what decisions are made, but why they are made and whose interests are being considered. Now I'll pass the presentation to Aska.
Communication and decision making. MapleCare needs a stronger two-way communication and more inclusive decision making. Important decisions should include nurses, physicians, managers, union, patients, and executives. Although every stakeholder may not agree, a transparent and participative process can increase trust and lead to more practical decisions. Next slide. Okay, based on our analysis, we developed 5 recommendations. MapleCare should stabilize its workforce, rebuild employee trust, implement human-centered technology, develop future healthcare leadership, and strengthen ethical decision-making. These recommendations should be implemented together as one connected leadership strategy. Our first recommendation is to improve employee well-being and retention. MapleCare should provide flexible scheduling, wellness resources, mentorship, peer support programs, employee recognition, and regular manager check-ins. Progress should be monitored through turnover, overtime, absenteeism, and employee engagement, and patient safety indicators. Next slide, please. So, our second recommendation is rebuild trust through authentic leadership. Executives should conduct regular unit visits, employee listening sessions, and town halls. Leadership should also close the feedback loop by explaining what employees said, what actions will be taken, and what concerns cannot be currently addressed. Next slide, please. Our third recommendation is to implement technology gradually through pilot projects. Doctors, nurses, IT specialists, administrators, and patients should participate in testing new systems. Employees should receive training on benefits, risks, limitations, and appropriate use of artificial intelligence. I will now pass the presentation to Abdul.
3.
Our fourth recommendation is to strengthen the leadership development. Managers should receive training in emotional intelligence, communication, conflict resolution, ethical decision making, and change leadership. MapleCare should also introduce mentorship and succession planning to prepare future leaders, and protect institutional knowledge before experienced employees retire. Next slide, please. Our fifth recommendation is to establish an ethical leadership and resource allocation committee. The committee should include executives, physicians, nurses, union representatives, and patient advocates, and healthcare ethics. It would review difficult decisions involving staffing, mandatory overtime, ICU capacity, service consolidation, and the use of artificial intelligence. Next slide. Thank you. Implementation should occur gradually. The first phase should stabilize the workforce. The second should introduce employee wellness and retention program. The third should focus on leadership development. Communication, employee participation, and performance monitoring should continue throughout every phase. With progress review every 3 months, I will now pass the presentation to Isra. Thank you.
Thank you, Abid, for your part. Now I will be discussing the expected outcomes, the outcomes that will come from our provided recommendations. So, what outcomes can MapleCare expect? We expect a higher employee engagement, stronger trust in leadership, better retention rate, improved communication, a healthier workplace culture overall. And ultimately, that will lead to a safer patient care. And to measure the progress, MapleCare can track the indicators, and the indicators would be employee turnover, engagement scores, overtime, the sick leaves, vacancy rates, agency staffing costs, patient wait times, safety incidents, and employee confidence in their leadership. Moving to the next slide. So now I will be talking about the associated risks and how we can mitigate that. So as we know, every change comes with some challenges, and employees may experience some change fatigue, like they can resist new ways of working, or they can be uncertain about using the new technology. Also, there can be budget constraints and inconsistent communication that can lead to some barriers, but this risk can be reduced by involving the employees at the early stage of the decision making. Starting with small pilot programs, keeping leadership communication consistent, and focusing on the changes that actually deliver the clear value. Moving forward to the next slide. So here comes our final consulting message, and that is a very simple message from us, that is sustainable change starts with people. So instead of asking employees to do more with providing them less, MapleCare should invest in their workforce by building trust, strengthening leadership, involving employees in the decision-making process, and using technology to support a compassionate and patient-centered care. That's how a sustainable care 2030 can become a reality. I'm moving forward to the next slide. So thank you for your time and attention. We believe these recommendations will provide a practical way towards a strong workforce, better patient outcomes, and a more sustainable future for MapleCare. And that's all from us.